We turn now to Dr. Isaac Bogoch, an infectious disease specialist who has been monitoring the coronavirus outbreak closely. Dr. Bogoch, we just heard U.S. Vice President Pence saying that the best estimate is that the threat to coronavirus to the American public remains low. But we've also had headlines this afternoon and learned that 8,400 people in California are being monitored for the virus. What is your best assessment right now of what's happening in the United States?
So, more globally, we see this virus moving from country to country day by day. We see a greater number of infections in countries that we know have this virus already. And of course, yesterday, there was that very high profile case in California of someone who acquired this infection with no travel history and with no obvious contacts to someone with the virus. So, the real question is, what is the burden of illness right now in Northern California? What's the burden of illness elsewhere in the United States? It's clearly more than this one individual there. And certainly these large public health initiatives are going to aim to find out exactly how much of this virus is indeed present.
And Dr. Bogoch, over the last couple of days, we've seen the headlines certainly grow more alarming here in North America. But as you assess the last couple of weeks for the virus as it's made its way around the globe, what's your view on the nature of the virus itself? We are still learning about what COVID-19 really is, but does this virus show, do you feel as a doctor like you understand more about what kind of characteristics this virus has versus the normal
100%.
Seasonal flu?
No, I think we obviously don't have all the answers, and we still have to remain humble that we're learning more and more, and we don't have all the answers yet. But of course, I think it's also unprecedented about how much we've learned about an infection that we didn't even know existed 2 months ago. And certainly we have a better understanding of how it's transmitted. We have a better understanding of its clinical manifestations. We have a better understanding of some of the more molecular and microbiologic uniqueness of this virus. And I really think that this is helping prepare for the, eventual introduction of this virus to other parts of the world, including the United States. And I'm sitting here in Canada, where we had a few recent cases introduced a couple of days ago as well.
So, Doctor, is it the case that it could have higher rates of infection in some countries rather than other countries? And why would that be the case?
I really think this is going to spread broadly, and it certainly has already done so, and I think it will continue to do so. How it impacts an individual country will likely be reflective of the resiliency that country has in terms of how robust their public health care system is and their medical care system is. And certainly it wouldn't come to anyone's surprise if there were a number of people who come down with this infection, either from imported cases or even from locally acquired cases. But of course, if people start to have symptoms, they're going to need care, and they're going to go see their primary care providers. They may be sick enough to need to be seen in a hospital. They may be sick enough in a hospital to need intensive care unit level care. So certainly a lot of this will revolve around the capacity of healthcare systems and countries that have the capacity to manage cases.
Sounds like more developed countries will do, sorry to interrupt, sounds like more developed countries will do better than less developed countries, though. Go ahead, Jen.
Unfortunately, that's usually the case in these settings. And, we have to do our best to support our own populations, but also support our friends and relatives around the world who are less fortunate as we are to help them manage these cases as well.
A remarkable part of this, just the last couple of days, we've spent much time focused on a vaccine coming, or how are we going to treat this. The issue right now, though, is also just how do we diagnose this? We have 8,400 people in California that are being monitored, and we can't test them all. Are you concerned at the rate that we are able to just test people to even find out if they have COVID-19?
Yeah, China's massive public health initiatives really bought us all time, right? That prevented the spread of this virus more globally by probably a few weeks to a couple of months. People, hopefully, governments and healthcare systems hopefully use that time wisely to scale up capacity. And scaling up capacity includes scaling up diagnostic testing. Right now, there's, of course, a few countries on a list that we have that are, at higher risk of getting this infection than other countries. But as this infection moves, that list of countries will grow and grow and grow, and soon it will become irrelevant because we're just going to see more widespread transmission of this virus. And in those situations, we're really going to say, okay, are you presenting with compatible symptoms like a fever, a cough, or shortness of breath? And that will trigger a diagnostic test. So what I'm really trying to say here is that there needs to be a scale up of capacity on multiple fronts, but scaling up diagnostic testing is certainly one of the major pillars that needs to be focused on right now.
Dr. Isaac Bogoch, an infectious disease doctor and professor at the University of Toronto. Thanks so much.
Thanks for having me on.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.